Hey everybody, welcome back to the NWA Connie Corso show where we talk all things dogs. Glad everybody's back. Guess who we got in the house? Dr. Judy Morgan. How are you, young lady?
I am doing really well, thank you.
Great. Well, we're glad to have you here. So could we just start out this way? Could you give us kind of an introduction to yourself and your background and tell us kind of what you do?
Okay, I'm Dr. Judy Morgan, and I was just given the award for Holistic Veterinarian of the Decade by the International Association of Top Professionals. So that's who I am, but I practiced in clinical practice, small animal medicine, and some equine work in New Jersey for 36 years, and retired and sold my clinics in 2020 and moved to North Carolina, where it's supposed to be warm, but it's not. And so in my retirement, it's a funny word, I have been growing my new platform, which is Dr. Judy Morgan's Naturally Healthy Pets. So we are an e-commerce site for natural pet health products for dogs, cats, chickens, and horses. And I'm an author. I just wrote my 9th book, which has not come out yet. And I have an educational platform, Dr. Judy U. My goal is to educate pet parents worldwide to empower them to be able to speak and advocate for their pets, to keep them healthier, and to, we are, as we move forward, we are people are becoming more adversarial with their veterinarians because people are becoming more educated.
Exactly.
And so my goal is to help people have conversations that are not quite so adversarial, but be able to stick to your guns and stand your ground and say, no, this is what I want to do because this is what I feel is best for my dog. Nobody knows your dog better than you do. And so it is really critical that you speak up and advocate for what your pet needs.
Facts. So I want to get into vaccinations and over-vaccination concerns you may have. But first, before we get into the thick of things, could you explain to me the difference in between core versus non-core vaccines?
Sure. So core vaccines, and this is decided by veterinary associations. So the American Animal Hospital Association, the World Small Animal Veterinary Association, WSAVA, and they come out with vaccine recommendations. So the most recent one was in, I believe, 2022, but they just made an update in 2024 for one specific vaccine. So a core vaccine is a vaccine that is recommended for all dogs. And a lifestyle vaccine is a vaccine that is recommended if a dog is at risk for that particular thing. So for instance, you have a toy poodle living in a high-rise apartment in the city. That dog has different exposure than a hunting dog or a search and rescue dog that's going to be out in the fields and going through different conditions and exposed to wildlife. Okay. So we have to look at what is this pet going to be exposed to and what do I need to do to protect my pet. I am not an anti-vaxxer, but boy, I am a responsible vaxxer, and that means giving a lot less than what we have done in the past.
So is there a blanket core vaccine that you think all dogs should have?
Not necessarily. So my youngest, he's now 3, and he's had 0 vaccines.
Okay.
So it's really different for every dog.
Right.
In the past, before I knew as much as I do now, my dogs used to get the annual vaccines when I first started in practice. That's just what we did 40 years ago.
Right.
And my Doberman at the time, my second or third year in practice, he suddenly went blind overnight. And he was fine. Went to bed, got up in the morning, let him out of the house. He ran straight out of the house, right into the side of the car and fell over. I said, why did you do that? And then I realized he was blind as a bat, couldn't see anything. And so I took him to a neurologist, and he had a spinal tap and an MRI and the whole 9 yards. And the neurologist said, well, he has granulomatous meningoencephalitis, which is basically inflammation of the covering of his brain. And he said it's due to his distemper vaccine. And I kind of, gave him this look like, what are you talking about? This was like in 1990. Oh, I was pregnant, 1989. So, at that point, I was very traditional. I had never been taught anything like that. Oh, vaccines can cause problems. They have side effects. What? And so that was kind of my first eye opener. And it still took me another 6 years to go into holistic medicine. But, it was the first sign of trouble on the highway.
Yeah.
So and over time, I have vaccinated less and less and less and less until now I have this one that hasn't had any. And that can be very tricky for people to do. So probably the most dangerous that we see is parvovirus, particularly in Cane Corsos, Labs, Dobermans, Rottweilers. They seem to have a particular affinity for developing really bad cases of parvo. And so there is a genetic aspect to that.
Okay.
So parvo is probably at the top. The government says rabies is at the top. I get it because that's zoonotic. People can get it. And if you get rabies, you're pretty much going to die. So I get it, except I think that we could, again, get the government to look at it differently and not make it mandatory every 3 years and maybe consider using titers or something else to prove immunity. So those are at the top. Distemper, we don't see that very often. It's kind of not, shelter medicine. If you've got a lot of puppies or, unvaccinated, poor immunity in a shelter, you might see some distemper cases, but we just don't see very many.
Right.
And then we get into, so those are the core vaccines. Well, and hepatitis, the adenovirus.
Yeah.
That we just never see. But it is considered core.
Okay.
So those are the core. Most recently last year, AHA came out and said, we want to add leptospirosis to the core vaccines. And man, I hate that vaccine. I hate it, hate it, hate it. I've never, well, not never. Since I've been holistic, my dogs do not get it, won't get it. I think part of the problem with lepto is it's spread through the urine of rats, raccoons, possums, skunk, fox, and dairy cow.
Yeah.
Well, with COVID and the lockdowns, the cities became rat infested. And so all of a sudden we were seeing city dogs get lepto because of the rat infestation. So in New Jersey, I remember probably the summer of 2020, there was all these news reels in Philadelphia and New York about dogs getting leptospirosis, huge outbreaks. Well, a huge outbreak was 4 dogs. But because of that, like one of the local clinics near us, it made me so mad. They did a vaccine clinic, a lepto vaccine clinic. It was a drive-through clinic. Your dog didn't even get out of the car. They literally, you pulled through, paid them your $20. They reached in, jabbed your dog, and you pulled out of the parking lot. And they did hundreds, which was, I was like, well, that was a great moneymaker. And we don't even live in a city. We're in a rural area. Good for you for, and they were on the news. And it just made me mad because that's not good medicine. That's not what we should be doing. Yeah. So lepto got added. I still would not consider it core if I were still practicing. I'm not going to give it to my dogs. Leptospirosis is a highly reactive vaccine, and it's not very good. It only lasts for 9 to 12 months. So that is one of those that if you're going to give it, you probably have to give it every year.
Right.
I don't want to do. But for small dogs in particular, man, do they react to that vaccine. We see so many anaphylactic responses, which is they blow up like a balloon, they vomit, they have diarrhea, and they fall over and they want to die. So really not good. Larger breeds of dogs tend to have less vaccine reactions, but that doesn't mean they never have a reaction, and it doesn't mean that there's no side effects or problems with vaccines. Right. So, for something like that, you really have to consider, where do I live? What is my animal exposed to? Does my dog swim in a stagnant pond where wildlife is coming and urinating? Yeah,
Mm-hmm.
you might have a little higher risk. Does my dog live in the city? Does my dog live in my suburban yard with no wildlife? Probably not an issue.
Yeah.
So that's the thing with the vaccines. Lyme vaccine, I think, is one of the dumbest vaccines ever made. It's only about 60% effective.
Mm-hmm.
And the problem with that is people go, oh, my dog has Lyme vaccine. I don't have to worry. If he gets a tick on him, it's no big deal. Well, what about the other 12 tick-borne diseases? Kind of a
Right.
big deal.
Yeah.
So, the key is keeping ticks off your dog. And that's another segment, which I'm sure we'll get into, because
Oh yeah.
we're going to have to
We're
talk about that.
Yeah.
So, I think when people give that vaccine, they get kind of complacent, like, yeah, no big deal. It's still a big deal. Lyme disease is very treatable, as are all of the tick-borne diseases. But you have to be vigilant and say, oh, he's kind of not feeling well. He's kind of got a swollen joint. He's limping a little bit. He's drinking a little more water. He doesn't want to eat. If your dog is sick, then you need to get treatment. And those diseases are so treatable.
Mm-hmm.
So I'd rather not vaccinate, because I want to be vigilant, watching for other things. And like I said, it's just not a good vaccine.
Right.
Kennel cough, you need that to go to boarding, grooming, daycare, training, whatever.
Yeah.
I've never given it to my dogs. I don't like it. It's another dumb vaccine. It's like trying to vaccinate your kid for a cold.
Mm-hmm.
It's not deadly. It's annoying.
Right. Yeah.
We have influenza vaccine, which is 2 different kinds of flu stuck in one. Never use that vaccine either.
Mm-hmm.
It's not that common. Occasionally we have an outbreak, and then it's using common sense. So there's other things like really rarely used. There's a rattlesnake vaccine. Again, all it does is buy you a little more time to get to the vet. It doesn't prevent them from dying from rattlesnake bite.
And, well, I think that's a ripoff too. I mean, breeders who know that we done dealt with snake bites, we know how to fix that right there on the spot.
Yeah.
So
I've got my vaccine chapter is in a couple of my books, and it's a long chapter because I go through each one of the vaccines, how
Okay.
it works, what the symptoms of the disease are, and how deadly it is, and whether or not it's considered core or not core, and how often it needs to be given if you're going to give it. So
What's
some
the
of
name
them.
of the book,
So I've got a couple, but the best one for that is Raising Naturally Healthy Pets.
Okay.
It's got a really good vaccine chapter, a really good parasite chapter. And for anybody who's new to doing things a little more naturally, a little more holistic, that book is kind of this is going to get you on the right road. And then Keeping Your Pets Naturally Healthy came out after that. And that one talks about all the different diseases that our dogs and cats get, what the diagnostics are for them, what the traditional treatments are, and what natural treatments are. It also has recipes, so for like kidney disease, liver disease, that kind of stuff, for both dogs and cats. So, like I said, the goal is to educate people so that you've got power in your hands.
Gotcha. You mentioned something earlier, titer testing.
Yes.
Can you elaborate on that and
Sure.
how it can help pet owners make informed decisions?
Absolutely. So a titer test is a blood test. Okay. So let's say that you found a stray dog, or you want to adopt a dog from a private family, and you have no idea what the vaccine history is on that dog. Well, your vet, even if it's an adult dog, is probably going to say, oh, we have to do a whole series, just like the puppy series. So you're going to come in, you're going to get your DHLPP, CV, KC, RV, Lyme, blah, 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 laundry list of vaccines. And then we're going to do a booster in a couple of weeks, which is crazy. First of all, you don't want to give everything at once. You got to spread them out. But you could instead say, this is an adult dog. I bet this dog had a vaccine somewhere or had an exposure somewhere in its life. Its immune system might already know about these things. So they can draw a blood test and send it out to the lab and ask for a titer. And so there are specific titers for distemper, hepatitis, parvo, and rabies. We don't have it for all the other things. We don't need it for those. And the titer will come back with a number. Well, some labs just say positive or negative, and some of them will give you a number. And if it's positive, it means your dog already has antibodies or immune system function against
Right.
distemper, against parvo, against
Right.
rabies.
Mhm.
Well, if the gas tank is full, you don't need to add more gas.
Exactly.
So a titer can tell you, hey, look at that. He's immune to all those things. That's great. You don't need to poke him with anything else. And that's
Right.
a good thing. So like my vaccination protocol for puppies, I've got it in a blog on the website and also in the book. I do minimal puppy vaccines because it makes me crazy that I would see that I get records all the time where puppies are getting a series of anywhere from 4 to 7, which is just crazy. They really need 2. Now, with those
2.
big breeds,
Okay.
2. Those big breeds, you might need a third parvo, but you can give an individual parvo without all the other things. So usually when you go, you get a combo vaccine.
Mhm.
So kind of the most minimal you can get is a DAP, which is distemper, hepatitis, and parvo. Most vets carry DAPP, which includes para-influenza, which is a respiratory thing.
Right.
That's fine if that's the best you can do. So what we have found is that if the mama is healthy and the mama has good immunity during pregnancy. So if you have let's say you have a female, one of your big guys, big girls, and she's had a vaccine at some point and you've done a titer and look at that, she's got great protection. Her protection is going to pass on to the puppies through that first milk. And that is going to protect the puppies against those diseases for anywhere from 8 to 16 weeks.
Right.
And so let's say mama's immunity is still in the puppy at 10 weeks, but we decide to start vaccinating at 8 weeks. That vaccine is wasted. It does nothing because mama's immunity is interfering with it. So what we have found is that if we wait a little bit longer, and again, you have to know that you have a healthy mama and these puppies can't be getting exposed to all kinds of things, like they're in their nice, healthy, happy home environment. And if we can wait a little bit longer, so it's a little different for the small breeds and the big breeds. I've never really talked about this before. This is interesting,
Right.
having to do a large breed show.
Right. Right.
I like this. So for our small guys, what we started doing is we would do a parvo vaccine at 12 weeks
Mhm.
and then a distemper vaccine by itself at 14 weeks.
Okay.
And then at about 18 weeks, we would run a titer. And what we found is these guys had titers through the roof because we hadn't confused the immune system by putting it on top of mama's immunity. We hadn't given 16 things at the same time. And so those dogs developed really good titers. And when we tested them a year later, they were still through the roof, just really good. Now, because of these big kids are a little bit different and they really are parvo problem kids, I would give them, so you're probably going to end up with a DAP. So if you can wait till 10 weeks, wait till 10 weeks. And they really shouldn't leave mama until 10 weeks anyway, because that is really critical socialization time up to 10 weeks with litter mates and mamas. So they should really stay together till 10 weeks anyway. I know the breeders sometimes like to kick them out of there at 6 weeks and 8 weeks. And, you know, they're getting big, they're obnoxious, they're messy, they eat
Eating up stuff. Yeah.
yeah, and those guys usually have big litters, so it's like, oh my God, I've got 15 dogs right now. I don't think I want 15 big dogs.
Right.
So I get it. But for their socialization, for their mental health, all that kind of stuff, they really are better to stay together until 10 weeks. So let's give that vaccine at 10 weeks and a DAP, and do another DAP at 14. And because these are the big kids that are more prone to parvo, I'd probably come back at 18 and do just a parvo.
Got it.
And I'm a huge fan of not giving the rabies early. Some states say we want it at 12 weeks. That's the earliest you can give it. My small breeds, I try to wait till 12 months old. And large breeds, I try to wait till 6 months. If they're in a well cared for, protected environment, you're not, you know, out playing with bats. So that's, you know, kind of a, but the big thing with that is give them separate. So if they're going in for a DAP vaccine today, don't give the rabies on the same day. Come back in a couple of weeks. I know it's a pain to do all those trips back and forth. So in my clinic, we had a deal where people could prepay for the vaccines if we were splitting them up. So let's say they came in and their dog had all kinds of exposure to all kinds of things. And they're like, no, I really need a DAP. I really need, I'm required to get the kennel cough. I have to get lepto because of exposure, and I need a rabies. Well, we would say, okay, that's great. We're going to do the physical exam today. And that's 4 separate vaccines that we need to give to your dog. That's 4 separate visits. So you can prepay for all the vaccines today. And then in 2 weeks, you have an appointment, you run in, they get that poke, they're out of here. 2 weeks after that, they run in, they get that poke, they're out of here. So they don't have to waste time at the front desk, checking in, checking out, all that stuff. They don't have to have the exam every time. So it was no big deal for us. It didn't cost us any more time or money to do it that way, but it allowed us to do a safer protocol for the animals.
Gotcha.
The other reason you want to do that, besides not stressing their immune system, is that if they have a reaction to a vaccine, you want to know which one they reacted to. So you go in, you get 5 vaccines and your dog's face swells up. You're like, well, I wonder which one caused that.
Right.
So if you do them separately, you can say, oh my gosh, he got a lepto vaccine today and now his ears are blown up, his face is blown up, his eyes are swollen shut, and he's breathing hard. But that was the lepto vaccine. So then you get to call the vet's office and go, well, we had a reaction to that one. We're not doing that again.
Exactly.
So, that there's just, it's so much better for the dogs, knowing what you have going on.
Exactly. Let me ask you
that's my vaccine spiel.
Okay. let me ask you about this. You mentioned the mother that's giving the antibodies to the babies. How long do you suggest you keep the babies on mama's milk?
Depends on the breed.
Okay.
A big mama is not going to support 13 puppies in a litter nursing off of her only until 10 weeks old.
Right.
So, I start puppies on solids at 3 weeks. So they start getting, along with mama's milk. So we're getting them started really early with eating real food, so that, we're getting more and more and more real food in, and they're not draining poor mama dry.
Right.
And some of these big litters, and I didn't deal with a ton of breeders, but some of these big litters, they were having to supplement. They'd either have to find a nurse mama or supplement anyway, because they just, these guys sometimes have huge litters.
Yeah. I found a good success by giving her breaks and letting her milk build back up. You know what I mean?
Yep, for sure.
Yeah. So let's get into parasite treatment and prevention, and we'll start with the exterior parasites. What are the most common exterior parasites that affect pets, and how can we treat them effectively?
So probably most common is fleas and ticks. That's, everybody has flea and tick issues.
Right.
Then after that, we get into different mange problems. So sarcoptic mites or Demodex mites. And that can be a bigger problem in some breeds than others. But fleas and ticks is, that's pretty generic. Now, there are areas of our country, high country of Colorado, no fleas and ticks.
Yeah.
Awesome. Yeah. Good reason to live there, except it gets a little snowy and cold, which I don't like. They also don't really have mosquito problems there. Now, I think you're in Texas, so
I'm in Arkansas.
Oh, you're in Arkansas.
Yeah.
Similar. Cockroaches this big. Hot, humid, a lot of bugs.
Oh, boy. Ooh, everything.
Let me tell you, just the difference in the size of cockroaches from New Jersey to North Carolina. I'm like, what? But I have seen the Texas ones, and no.
Yeah.
So the biggest problem with fleas and ticks is that people are scared to death. They get like, oh my God, if he gets ticks, he's going to get Lyme disease. Oh my God, if he gets fleas, he's going to get tapeworms, and he's going to get bubonic plague. And that's the scare tactics that are used to talk people into, you need to put a chemical in or on your dog every month, all year round, to prevent them. And here's the problem. most preventatives don't prevent. The flea or tick has to bite your dog in order to die. So we're not preventing tick-borne diseases if the tick has to bite the dog in order to die. So that's one of the problems. So what we want is something that's actually going to repel them and make the dog not taste good and make the fleas and ticks go, yeah, I don't want to eat him. And the healthier your dog is, the less parasite problems you'll have. So, you know, if they're fed the right diet and they're not over-vaccinated and they haven't been treated with a bunch of chemicals, you're going to have a healthy dog who is going to be less prone to parasite issues. The biggest problem with the chemical parasite drugs, they are neurotoxins, which means they are toxic to the nervous system. So the brain, the spinal cord, the nerves. And we see so many dogs. And of course, I see more because I'm holistic. So people are like, oh my gosh, my dog had a big reaction. Now I got to go find somebody to tell me how to detox them because there's no antidote to these things.
Right.
So that's what I probably see a lot more than what a typical traditional veterinarian might see. But the neurotoxins are supposed to be neurotoxic to fleas and ticks. Unfortunately, some dogs are very sensitive to them, and it has nothing to do with the MDR1 gene. It's just some dogs are more sensitive to them, and they will develop seizures or tremors or dry eye or falling syndromes. I mean, just so many things. And some of these drugs also are used as anticoagulants, which means they stop clotting ability. So we've had some dogs who bleed out into their abdomen or into their chest. So you give the chemical parasite chew, and the next day your dog's dead, and you're like, what the heck happened there? Because you can't see anything. And if you do an autopsy, you go, well, look at that. He's got a chest full of blood or an abdomen full of blood. And the problem is with these, there's actually a class action lawsuit against Bravecto.
Bravecto, yeah.
And I was part of the research on that one because Valerie Palmieri, she had a 1-year-old German Shepherd, and the dog was given a Bravecto chewable at its vet appointment. That night started seizuring, ended up in the emergency in ICU for a week. And the dog is probably 5 years old now, maybe 6. He still can't walk in a straight line. He is so neurologically impaired. And when he was a couple of years old, he had a seizure and she couldn't get to him fast enough. And he fell down a flight of stairs and shattered his front leg. So that was about $15,000 to put his leg back together. So hence the class action lawsuit.
Right, yeah.
But we did a survey of pet owners, and 2/3 of the pets that were treated with that responded, people responded to the survey, 2/3 of them had some sort of reaction or problem with these chemical parasite treatments. And we had a meeting with FDA, and we said, look, this was about the isoxazoline. So that's Bravecto, Credelio, Simparica, NexGard, Simparica. That's that group. So we had a meeting with FDA, and God bless them. They gave us an hour of their time, which is really hard to come by. So, and we told them the results of our survey, and we said, we're seeing so many dogs reacting and having seizures and problems. The veterinarians aren't aware of it. And, at that point, the European Medical Agency, which is equivalent to our FDA, had about 300,000 complaints. FDA already had about 150,000 complaints. Now, FDA will readily admit that the number of adverse events that are reported to them is only 1 to 10% of what's actually happening out there.
Oh, wow.
So if we've got 150,000 complaints and that's only 1% of what's actually happening, holy cow. And so we said, well, what are you going to do about this? We think these drugs need to be taken back and not be approved. And they said, oh, there haven't been enough problems yet. Thousands of deaths. And part of the problem, so I had a family with 3 dogs. They took them to a vaccine clinic. All 3 dogs were given Bravecto. All 3 dogs were given 5 vaccines. 2 of the 3 dogs were seizuring within 24 hours. So they came to me. And I said, well, this needs to be reported. We got to report this to FDA. We got to report it to the vaccine companies. We got to report it to Bravecto's manufacturer. It if we don't report this, nobody knows. And then this is how it gets brushed under the carpet. So the people were all on board as long as I was doing all the work. So I reported it. The vaccine company said, oh, we're not responsible. That's Bravecto's problem. Yeah, you go to them. Went to Bravecto and they said, oh no, it was caused by the vaccines. You go to them. No one would take responsibility. This family got no compensation, nothing in return. And meanwhile, they've got 2 dogs that are on seizure meds for life.
Wow.
And, so the one thing that we did get out of that meeting and out of all the complaints was that the FDA did say for that class of drugs that they had to put wording on the box, on the label, that said, probably should not be given to, may have some neurologic side effects, probably should not be given to dogs that suffer from seizures. Nothing about this drug will cause seizures.
Right. Yeah, that makes sense.
Exactly. So, it's like, oh, almost. And when they make manufacturers make changes on their labels, they give them 6 to 24 months to make that label change. So, because they're like, well, if they already have 2 million boxes printed, we don't want to make them throw them away. Okay, I get that. But 6 to 24 months, it's like this really big window. And if you're the manufacturer and you're going to put a warning label on, are you going to do it on day 1 or are you going to do it on the very last day possible?
Very last day. Yeah.
Exactly. Yeah. And part of the problem is like this family of dogs and even Valerie's dog, the veterinarian did not give the owners the package. The owners didn't even have anything with a label because what they do is they just feed the chew in the office.
Right.
Well, and so this is my warning to your listeners. Anytime that a drug of any, I don't care if it's an antibiotic, a dewormer, anti-nausea, ask what potential side effects could I see? And if they say none, say, I don't think so. Because everything has, too much water can kill you. So everything has a side effect. And if they tell you there's none, then the little handheld computer that we all carry in our pockets,
yes, ma'am.
type into your search engine the name of the drug, side effects. So they want to give it Bravecto, type in Bravecto side effects, and it'll bring them up. And then you get to make an educated decision. Ooh. Do I want to risk that? Ugh, gosh, it sounds a little, man, death is one of the side effects. I don't know if I want to do that. So, and I would say that even for human medicine, like I've had so many arguments with doctors. Oh my gosh, not for me, but for family members, because I'm always the person in charge.
Right.
Ask questions. What are the side effects?
Right.
And if I made one poor young doctor, my mother was in the hospital and they wanted to put her on 3 different IV antibiotics. And the doctor hadn't even seen my mom yet. We were in the ER. No one had come in and done an exam. No one had seen her, but they sent the nurse in with 3 bags of IV antibiotics. And I was like, what is that? We haven't seen a doctor yet. And she told me what they were. And I said, you're out. I said, I'm going to talk to a doctor. A doctor is going to examine her before they prescribe anything.
Right.
And so this poor, I don't know if she was an intern or a resident, but she came in and I said, you haven't even examined your patient. How can you be prescribing something? Well, I read her chart. I'm like, that doesn't qualify. And I said, do you know the side effects of those drugs? And she kind of hemmed and hawed. And I said, listen, this is my 85-year-old mother. I kind of like her. And we're not going to do this unless you can tell me the side effects of those drugs, because I happen to know the side effects of all those drugs from an animal perspective, but it's similar. Right. And so I made her get out her phone and look up the side effects of all 3 of the drugs.
Oh, wow. Yeah.
And then I said, would you give that to your 85-year-old mother? So we settled on one of them. Right. I said, I'm going to let you do this one. Okay. Not everything else. But that's the advocate that you need to be for your family members, for your pets. You need to have an informed decision. So, don't ever be afraid to ask a question. Ask it nicely. Yeah. But don't ever be afraid to say, hey, are there any potential side effects to this? So anything I should know about? What should I be watching for? Is he going to drink more? Is he going to pee more? Is he going to puke on my rug? Is it going to stain my rug purple? Like things I want to know. But again, if you've got your phone, look it up and then make a decision based on that. And if you don't feel comfortable with what you see when you look it up, then say, oh gosh, I'm worried about these side effects. How often do you see them? Is there something else we could use that might have less side effects? Is there an alternative?
Right. Why do you think companies this big would risk the class action lawsuits, or when they have evidence of things going wrong? You know, like Roundup, they had the big
Because they make so much money. And
yeah,
so
they can handle it.
Those drugs came out in 2014. So they've been out a little over 10 years.
Mm-hmm.
They have made billions. So there's a new drug out called Librela for dogs and Silencia for cats. That's for arthritis pain.
Mm-hmm.
And there's class action lawsuit against that now. And it's only been out a year, maybe two.
Mm-hmm.
It's killed so many dogs and cats. And one client, I happened to work for a malpractice legal group writing opinion letters. And one person said they had spent $12,000 trying to save their dog from the side effects from Librela.
Wow.
And they complained to the company and said, we want our $12,000 back. We can't bring our dog back, but we want our $12,000 back. Mm-hmm. And the people at Librela said, yeah, we can't pay you that much. We have too many suits that we have to settle.
Wow.
Yeah. It's like, okay, you are making billions off of this drug. It's just like they're one of their leading drugs. We're making billions off of this drug, but we can't give you your $12,000 back or your dead dog. That tells you a lot right there. That we have too many suits. We can't settle them all. And if you do settle with them, you have to sign a non-disclosure that you won't tell anybody about what happened. Yeah. And so most of these pet owners will not sign. They'll forgo the money because they want to be on social media proclaiming to them. And thank God they are, because how would people know? Right. TV commercials don't tell you all the problems.
Yeah. I bet you this episode is going to resonate with somebody today. You know what I mean? So
I really don't hold back. I'm sorry.
No, we don't want you to. We definitely don't want you to. So we talked about the side effects and things like that. Are there any natural alternatives that you could suggest for flea and tick prevention?
Oh, absolutely. Absolutely. So in that Raising Naturally Healthy Pets book, we've got tons. And on my website, we have tons. So you don't even have to buy a book. You can just go read one of the blogs. Okay. We have so much information on this. So I don't use any chemicals on my animals. Mm-hmm. And I have outdoor cats that, live on the farm. And we're a chemical-free family. So we use herbs. We use herbal powders. We use essential oil sprays. We use garlic. Garlic is amazing. Feeding fresh garlic, chop it up in their food. We've got doses for all these on the website and which essential oils work really well. If your dog is in if you live in a suburban area and you have a yard that needs to be treated because you always have fleas, you can use beneficial nematodes, which are basically little bugs that you spray in their yard that eat the flea eggs and larvae and the tick eggs and larvae. Yeah. Oh, okay. So my daughter was having a huge flea problem with her cats and dogs. And so she said, okay, we're gonna do a video of me spraying my yard with nematodes. And so she sprayed her yard with the nematodes, and that finally got rid of it. I had a client in Florida that I did a consultation with, and she's like, oh, man, every year I just can't get rid of these fleas. I said, first of all, the flea only spends 5% of its lifetime on the dog. So that means 95% of your flea population is in your yard, in your house, in your car, wherever. Yeah. So we all get so hyper-focused on feeding chemicals or putting chemicals on our dogs to treat 5%. What about the other 95? If you're not treating the environment, you're never going to get rid of your problem. So we can put the nematodes on the yard. My sister lives in Massachusetts, huge tick problems. And so she has a company that comes and sprays natural cedar oil on her yard every month. Okay. During tick season. And it works beautifully. She has to repeat it. I've got a friend in Georgia, and he uses, oh man, I can't remember which essential oil. He might be using peppermint oil, but he has a company that comes and sprays it, and it keeps the mosquitoes away. It keeps everything away. So you can find a natural company that will do that, or you can do these things yourself. There are some natural essential oil companies. There's one based in Texas that they have essential oil yard sprays. You hook it up to your hose, spray. I mean, these things work really, really well. So for my barn cats, I use an herbal powder. Because they can't wear collars. I don't want them getting hung up somewhere, and I don't want to give them chemicals. And the powder is so easy. I sprinkle it in my hand and pet the cat. Done. It can't be any easier.
Yeah.
And remember, I live in the South. I live in North Carolina. You know, we have heat, we have humidity, we have fleas, we have ticks, but we don't have problems. And it would be better to be a little bit, preventative with essential oils, powders, and there are things that you can add to the food. So we have a bunch of products that are powders that you can feed that have like neem and yarrow. They're herbs that make the animals taste bad. So the fleas and ticks are like, ew, they smell terrible. I'm not getting near them.
Okay.
So this is what we want to do. We want to repel them rather than having them have to bite our animal to die.
Exactly.
It's like, I don't even want them near them.
Exactly. What are your thoughts on, I might torture this, diatomaceous earth?
You did not wreck that. Diatomaceous earth. So that is actually in the powder that we put on our cats along with neem and yarrow. So the big thing with diatomaceous earth must be food grade. And you can put it in your yard. You can use it in your house. You can use it on your pets, but it is very drying to the coat. And you want to be very careful. Don't poof it because you don't want them inhaling it. It is really bad for the lungs. So the same for you. Like, don't make a big dust cloud with it.
Right.
But it can be very effective. Because it's so drying, I tend to use other things like the essential oils. Coconut oil, good high quality coconut oil is actually, the lauric acid in it is very flea repellent. It's also very moisturizing for the coat. So you can take a high quality coconut oil. The only one I use is made by a company called Coco Therapy. So I take that, rub it between my hands, rub my dogs. Look at that. The coat's shiny, their skin's soft, and the fleas hate them.
Oh, wow.
So many things that you can do, and you have to, if you're in a high flea or tick area, you're going to have to layer multiple things. So you might have to add a powder to the food. You might have to spray the dog. You might have to spray or put something in your yard. You might need multiple layers, particularly if you've had an ongoing problem where you just haven't been able to get rid of them. Hit them hard, hit them with every natural thing you can. And if you're diligent, you're going to get rid of them. Another thing that I would highly recommend is get rid of carpet. I have no carpet in my house.
I have absolutely no.
If you have dogs, you do not want carpet.
No.
For a lot of reasons.
Carpet just hold small micro trash. That's all it does.
It does. It is, I was thinking about it this morning as I was laying in bed. I was like, so we've got this one area, our house is pretty new, but we've got this one area where the floorboards didn't lay right. And I'm like, man, if I didn't have any dogs, would I put carpet in this bedroom?
Exactly.
I'm like, no.
Yeah.
It holds dust and dirt. No.
Right. Yeah. No. Yeah. It's no carpet. In my last two houses, it's been no carpet. I don't got time for it. Yeah. So let's get into pharmaceutical companies, what some people call big pharma.
That's a dirty word.
Yeah, it is a dirty word. In your experience, how does these companies influence the decisions of pet owners and veterinarians?
Same way they do with people. So, it's funny because people will say, oh, the veterinarian must get kickbacks for pushing these drugs. Well, they don't get a kickback. They get paid for, they pay $25 for the Bravecto pill and then they charge you $50. That's not a kickback. That's just making money.
Yeah, right.
So, but these companies, Big Pharma and Big Pet Food, and I'm sure we'll get into that segment too. Big Pharma and Big Pet Food finance the veterinary schools. They finance veterinary education. So I'm leaving Friday to go to probably the biggest veterinary conference in the world in Florida. It's called VMX. It used to be called North American Veterinary Conference. They changed it. there'll be 30,000 there, and you walk in and you are bombarded with signs for every pharmaceutical company, every big pet food company, and every lecture is sponsored by pick one. And, their booths are $500,000 booths that are huge, and they're freebies and giveaways. And, it's literally bombarding the students and the veterinarians. So when I was a senior in vet school, he was junior, our entire class was, and they did this for every vet school. There was a drug company called Upjohn. It's been sold multiple times, and I don't even know who owns all their stuff now. But they were in Kalamazoo, Michigan. I went to University of Illinois. So we all jumped in our cars one weekend, drove up to Kalamazoo. They put us up at a nice hotel, fed us really nice meals, had a big old banquet and party and dance, gave us a tour of the facility, which was really cool to see how the drugs are manufactured. So, kind of cool.
Right.
So it was educational, but it was a wine and dine and handing out all kinds of stuff. And so when I graduated, all of their products were in a red stripe on a white box label. So you knew it came from that company. And my first year in small animal practice, if I had to grab a drug off the shelf, you better believe it was going to be that red and white box. They had wined and dined me and treated me really well. How cool was that? They're amazing. And when you go through a drug manufacturing facility, you see the quality control that they have to go through to keep everything clean and, blah, blah, blah. Exactly. And so in your mind, you're thinking, well, this is awesome. Look at it. Look what a great job they do. Until you find out that, wow, there's a new drug that I just did a video on last week. And in their initial trial, 1/3 of the dogs died. I found it when I read the drug insert. I was like, wait, what? What? 4 out of 12 dogs died during the study period? And they just kind of wrote them off. Well, this one died from something unrelated. It was blah, blah, blah. This one died from something else unrelated, blah, blah, blah. I'm like, I'm sorry. 4 out of 12 dogs do not die in a 3-month period, all taking the same drug, and you get to write it off as something else.
That's crazy.
But this is what they do. So you can twist a study any way. You pay me enough money, I can write you a study showing how wonderful your thing is. And I can discard those ones that die, and nobody's the wiser. So in the drug insert for Bravecto, for instance, they had a couple of dogs that died like the 3rd month into the trial after their 3rd dose. And they were like, yeah, we don't really have an explanation for that. Oh, well.
Right.
Yeah, oh, well.
Yeah.
Not, oh, well. Like, we need an explanation.
Yeah. That's crazy.
So, there tons of money. Just tons. Just shower them with money. Free heartworm pills for vet student dogs. Look at that. Free or discounted drugs for employees at the vet clinics. So you buy loyalty. Right. And your drug rep, they're salesmen. They go in and they talk to whoever's buying the drugs, whether it's the veterinarian, the head tech, the business manager, and they hand you their beautiful flyers with all the wonderful things this drug is going to do for all of your patients. It's the best thing since sliced Wonder Bread. Right. We all know how bad that is now. Right. So, but they don't tell you the side effects, and if it's on there at all, it's in print that is so small that without a magnifying glass, you'd never find it. Just like the commercials and it does this and it does this, and by the way, it might kill you and you might bleed out and it might cause seizures, and that they get in 1 second at the end in such a soft voice that you're like, did he just say what I thought he said? So and most veterinarians are incredibly busy. And they're not going to go read the drug insert unless you're a crazy person like me. And they're like, well, hey, they said it was great, and look at this. 2,000 dogs made 100% better. Blah blah blah. Right. I can't blame the veterinarians completely, but I just wish they'd be a little more open-minded. I wish they'd do a little more research. Same with doctors. I mean, oh my God, my dad had Parkinson's, and
Hmm.
so treated, very traditionally. I couldn't get him to think about anything else.
Yeah.
And he was on 30 different medications.
Wow.
And it's like, well, he had a side effect from this one, so he needs another one to get rid of the side effects from that one. Oops, got a side effect to that one. Now we need a third one. And it's like, and 10 different doctors, and everyone is prescribing something different. And so you're sitting there with this boatload of stuff going, should we think about how these interact and what's
Right.
going
I
on?
know
And
exactly what you're talking about. With my dad, when he was taking all his medication, one was affecting him, another. It's a mess. Yeah.
it is a total mess. And so,
Yeah.
then my parents moved in with us, and so every time my mom would bring him back from a doctor and go, well, they're prescribing this. And I go, wait. And so I would go look up the drug insert and go,
Mhm.
yeah, that interacts with that one. And look at the side effects from this one. Do we really want to go here? And so I nixed a lot of them, or made them change them out for other things. It's just, again, it's that being vigilant, asking questions, always wanting to know. Like,
Yes.
it's
Right.
be curious. Curiosity did not kill the cat.
Right. No, no.
Be curious.
Exactly. Exactly. Let me ask you this. Since you was talking a bit about vet school, how much emphasis, we're gonna roll over into food, but
Okay.
how much emphasis was put on nutrition in your veterinary education?
So now we're going back 40 years,
Okay.
but it hasn't changed much.
All right.
So the only thing that's changed is there's more bad food companies out there now. There's also more good ones, which is,
Okay, good.
thank God.
Right.
But when I was in school, the only prescription diets were Hills. And so we call them alphabet soup because, it's KD, GD, BD, LD. So we have this alphabet soup. And at that time, they only had about 5 of their alphabet soup. And so in our junior medicine class, we're learning about kidney disease, how it happens and what the symptoms are and how to test for it and how to treat it and blah, blah, blah. And so for diet, it was always, and you use KD, and then if they had heart disease, and you use HD. I'm like, okay, that's all we got. And there's a chapter in my first book, From Needles to Natural, where it's called Pet Food Salesman,
Mhm.
because the second clinic that I worked in out of school, we sold more Hills prescription diets than any clinic in the country. We were a little
Wow.
2-doctor practice. We sold more than any in the country. My boss got trips all over the world,
Wow.
paid for by Hills for
Yeah.
being such a good salesman. And I was part of it, I'm sad to say. So what they are taught is these are the prescription diets that you can prescribe, and by the way, make money on. These are the prescription diets that you can prescribe. Never are they taught how to make a homemade diet, how to balance a diet, what extra nutrients would need to be added to a diet. Interestingly, I had a house call vet when I first moved here to North Carolina, and she was from the Czech Republic. And she came to euthanize my mother's 17-year-old dog. And so we got to talking, and I told her who I was, and I gave her some of my books. And I asked her how she felt about homemade diets and raw diets. And she was like, oh man, that is so cool. Very few people do that. And of course, I gave her one of my cookbooks, and she's like, oh my gosh, this is so cool. And I said, well, in school, did you learn about diets? She said, oh yeah, absolutely. She actually worked for a pet food company livestock food, formulating chicken diets, poultry diets, and cattle diets.
Oh, wow. Okay.
And so over there, at least in that country at that time, she learned how to formulate for every species. Every species.
Mhm.
So for us here in the States, one of the prerequisites to get into vet school is you have to have an animal nutrition course. So I took mine in undergrad. And could I have formulated, like if I really got into what they were doing, I didn't care at the time, could I have formulated rations? Maybe, but probably not. Most likely
Okay.
not. We were just kind of given the basics of what certain animals need.
Okay.
In vet school, no nutrition class. Nothing specifically. Now, some schools do like a couple hours, but I would bet you that 95% of the new grads are telling their clients that, no, you cannot feed your dog a homemade diet. It's not going to be, you can't possibly make it complete and balanced. Your dog's going to die. Because I hear this all the time from people.
Right.
Yeah, my vet told me I can't do it. My vet told me you have to have grains in the diet. My vet told me I can't use that new small boutique company that's making, beautiful food, human grade, because they don't have veterinary scientists like Hills and Purina and blah, blah, blah.
Right.
So there's a huge divide.
Yes. So you mentioned in homemade food. So I'm taking that you maybe cook for your dogs, or are they on a raw diet?
Mine are on part raw and part gently cooked.
Gently cooked. Okay.
Gently cooked, yeah.
Okay.
No, kibble is not allowed anywhere near my house.
Okay.
And no,
Right.
we used to do a ton of rescue work, and so these dogs would come in that were just train wrecks. And like the worst one we got, it came with a plastic shoebox full of the kibble that the dogs have been fed.
Mm-hmm.
And I'm like, well, I'm not even taking this in my house. And so I took the lid off to dump it in my trash can, and it was filled with maggots. So I'm like, wow, this is really good nutrition that these dogs have been getting. No wonder they have every disease under the sun.
Right.
I at one time we had 13 dogs.
Mm-hmm.
And I was grinding all my own raw food at the time, so that was a little bit of work. They were small; they weren't the size dogs you have,
Right.
but still, 13 dogs is a lot of food. So we would grind about 150 pounds every other week, and then label it and put it in the freezer. Now I formulate for pet food companies, and I've written quite a few cookbooks for dogs. The most recent one is Yin and Yang Nutrition for Dogs 2.0, maximizing health with whole foods, not drugs. So, we talk about diets for kidney disease, heart disease, liver disease. How do you heal your dog without having to use chemicals, without having to use prescription diets that are just made with god-awful ingredients? And I don't want anything synthetic in my dog's life if I can help it.
Mm-hmm.
So I don't want synthetic chemicals and synthetic nutrients in their food. So I don't want to see, when I read a label, and here's a take-home tip: when you read the label of your dog's food and the first three things you might be able to pronounce, and then all of a sudden it looks like chemical soup.
Oh, wow. Yeah.
You don't want the chemical soup. The chemical soup is where mistakes happen. So when we had the huge recall in 2018 and 2019 because there was too much vitamin D in the food, which causes kidney failure and death. So we had tens of thousands of dogs and cats died before somebody figured out that, hey, there might be a problem with the pet food. So you don't want to see that, because if there's a mistake made in that formulation, you could have a dead animal before somebody figures it out.
Right.
So, but it's really hard to overdose a vitamin or mineral using whole foods.
Mm-hmm.
The body says, oh, I need some of that, and I need some of that, and I don't need that, so I'm going to pee that out. So I really like seeing foods and in my own recipes. I want to see no chemicals. I don't want to see an add-in. Now we will add in things like fish oil, but that's still a food. It's not a synthetic. It came from a fish.
Yeah.
So that's how I formulate. I also I'm a firm believer that our dogs they're not. So cats are obligate carnivores. Like, they're meatosauruses. We got to feed them meat. That's feeding them corn and soy is just ridiculous.
Work. Yeah.
It just doesn't work. Our dogs are, oh gosh, Ian Billinghurst terms it beautifully. But they lean more they are omnivores, but they lean more toward a carnivorous omnivore.
Okay.
So, if you wanted your dog to be a vegan or a vegetarian, you could do it. Are they going to thrive? No. Is it the best way to raise them? No. Kibble is going to be, like true extruded kibble, maximum about 27% meat, and the rest is all fillers. And that's because it won't go through the extrusion process. It gunks up the machine. It makes a big gooey mess. It won't make little hard, dry brown balls. So that tastes terrible until they spray it with fat, by the way. And then it gets rancid and a million other problems. So when I formulate it, they're very low carb. I don't use starchy carbs in their diets. There is the prey model raw, which is no vegetable matter. I'm not a believer in that.
Okay.
Because people do it wrong. If you do it right, you can get away with it.
What do
But
you
that
mean?
doing it right is the feeding the whole animal, the feathers, the fur, the
Everything.
brains, the eyeballs. You got to feed everything
Yeah.
because you need that fiber. So we get people who are like, oh yeah, I'm prey model raw. I do meat, bones, and organs, and it's like, yeah, left out some pieces that are really important. So sometimes for just a break, I will feed my dogs just whole ground rabbit or whole ground quail, just for something fun. But that's not their main diet. I include raw eggs a lot. I include fish, and I do include some vegetable matter because they need the fiber for their gut microbiome.
Right.
So one of the companies that I formulate for has my big recipe is pup loaf. It's available pretty much everywhere online. Anybody, if you put pup loaf in the search engine, you're going to come up with me and my recipe. There's a few different versions of it, but it's complete and balanced, and you can feed it raw. You can feed it gently cooked. It's now made commercially by a company in Georgia.
Okay, cool.
Called All Provide. And then they also make my Constitutions diets, which are based on Chinese veterinary traditional Chinese veterinary medicine food therapy. So it's kind of modeled after my books with, treating different things based on your dog's personality. So we can change a lot with behavior. We can change a lot with health conditions using food. And that is so cool. And you know what? How much better is that than having to go to the vet every month and pick up another 30-day prescription for $100 for some drug to treat symptoms, and you're still not getting to the root of the problem.
So what you saying that was a question I was going to ask you. Do you think Western the philosophy on medication just suppresses the issue, not heal the issue?
Absolutely. It's kind of a shame. That's why we have all these immune suppressing drugs: Apoquel, steroids, mycophenolate, cytopoint. They're treating symptoms. It's like, oh look, we got rid of the itch.
Same with us.
Okay.
Yeah.
Yeah, exactly.
Yeah.
Oh, we got rid of the itch. That's a beautiful thing. I don't have to listen to the collar jingling and the tags, and I don't have to put up with that dog shaking the bed when he's scratching. Yeah, that's great. And you just gave him an immune suppressing drug, and next year he's going to have cancer. That's awesome. And then how many drugs are you going to need for that? And how much is that going to cost you to fix? And how much suffering do you and your dog have to go through because you were given a drug to suppress a symptom instead of curing the problem, curing the allergy, curing the yeast infection, curing the underlying problems? With Western medicine, so many of these dogs get stuck. Well, dogs and their owners get stuck in these cycles of, okay, I went to the vet and he's got a skin infection. He's got, yeast and bacteria. And so we got this special shampoo, and then we got our antibiotics, and then we got our immune suppressant, and we give it to him for 2 or 3 weeks. Oh, God, he looks so much better. This is awesome. 2 months later, you're back at the vet, rinse and repeat. And you're getting nowhere. It is like, just get out your treadmill and start walking on it, and throw money in the pot while you're walking, because that's all you're doing.
Right.
You need to get to the root of the problem. And when you get to the root of the problem and cure it, you don't need those drugs, and you're not causing other problems like cancer.
Right. Okay. Man, these folks going to enjoy this.
I hope so.
Yeah, they are, because I have had people, not very many, that says the same thing as you, that you're saying. They don't give the vaccinations and things like that. One thing we're taught, if you got a really good breeder, we're taught to breed like Mother Nature, resistance to things.
Exactly.
You know what I mean?
Exactly.
So, yeah.
I mean, genetics play a huge role, but there was a really interesting study that came out of University of Helsinki a few years ago, and it's in one of my blogs on allergies. But they looked at adult dogs, breeding dogs that had allergies. So German Shepherds are like way up on this list. So they looked at the adult dogs with allergies, and then they looked at the puppies to see, did they inherit that trait to have all these allergies? And What they found is that if you had adult dogs with allergies and you put the adults on raw food, and then when the puppies were weaned, they went on to raw food, they had a very tiny chance of developing allergies. If the parents were fed kibble and then the puppies were weaned onto kibble, it was almost 100% chance that they were going to have allergies as well.
Okay.
So we have to look at this and say, okay, is the genetics saying that we have allergies, or is the genetics saying that, we're a little overly sensitive to synthetic chemicals and highly processed things in our food? So one of my best rescue stories, I rescued this little Cavachon, so Cavalier Bichon. And I mean, she had bladder stones, she had skin and ear and eye infections that were just, the owner didn't have enough money to treat. So every time she would take the dog to the vet, she would get, a couple weeks worth of antibiotics and shampoo and special diet, whatever. And she would only use part of it so that she could save part of it for the next round. So the dog never got fully treated. So it just kept getting worse and worse until she couldn't do it anymore. And so I figured, okay, and she was eating a really low quality, highly processed food. And I said, okay, this dog's probably got all kinds of food intolerances and, just a mess. So I did surgery to get rid of the bladder stones because I was like, you know what, I'm not going to take the time to try to dissolve them. We're going to get rid of them fast. Got rid of the bladder stones. I did put her on antibiotics because she was just so horrible at the beginning, and put her on a homemade diet. And rabbit is one of the least allergenic diets. So I made a homemade diet rabbit formulation for her.
Okay.
And then we did that for about 2 months, and she was looking really good. And then we put her on a homemade pork because that also is not as common in pet food. And she was doing really, really, really well. And after 6 months, she had grown back all her hair, her elephant red, black skin, gooiness all went away. She was a happy, healthy dog. I said, all right, time for a challenge. I am going to feed this dog chicken because chicken is highly allergenic. I'm going to try chicken. And I made her a homemade meal of chicken. Nothing. No reaction.
Okay.
So even if you get a test back that says, hey, they're allergic to chicken, maybe they're just allergic to highly processed chicken.
Right.
Maybe once you get their system cleaned up, maybe they don't have any food intolerances and they're going to be just fine with whatever you feed them that is human grade, gently cooked or raw, not processed. So their bodies are just, reacting. When we get these interdigital cysts between the toes, or we get the ear infections that are oozing, or we get oozy things on the skin, that's just the body saying, oh my God, there was crap in here and I want it out there. I'm sending it out there. And so bully breeds, any of the bully breeds, they, especially if they're white, oh my gosh, if you feed them kibble, you just go get in line for your Apoquel and your antibiotics. And it's funny, my daughter's riding instructor had a couple of English bulldogs, no, American bulldogs. And so one day I was sitting there while she's taking her lesson and the instructor came in and she said, hey, I know you're a holistic vet. I got to ask you a question. My dogs, man, I just keep getting them on antibiotics. They've got these interdigital cysts. Their skin's always breaking out. They fart all the time. They smell bad. Like, I don't know what to do with these dogs. And so I gave her my spiel on food and I said, this is the raw food I want you to go buy. And this was quite a few years ago, so we didn't have as many choices. I said, this is the raw food I want you to go buy. I want you to put your dogs on this for 30 days. It's going to be a little bit pricey, more than you're used to spending. And she's like, I don't care. They're my babies. I said, okay, give it 30 days and let me know. Literally the next week, she's like, oh my God, everything cleared up. These dogs are, there's no more gas. I can stay in the room with them. It's a miracle. And so now I think she has 5 of them and they're all raw fed. And I see them online all the time. And it's like, oh my God, her dogs are gorgeous, beautiful, no complaints of ear infections, skin infections, cysts. I mean, it is, one of my office managers that I had for a couple of years was really into bulldog rescue. Mm-hmm. Bulldogs are not my breed. I've never had a desire to own one because they have a lot of issues. Right. Of course, the breed that I have has a ton of issues too. So no matter, it's different issues. And so I learned about things like the tail pockets and the facial fold goo and, all the problems that these dogs have. And so all these dogs come into rescue and they're a train wreck. Mm-hmm. And of course she was all into the kibble until she came to work for me. And I said, look, I'm telling you, we can look like heroes and you can get these dogs adopted into the best homes, but you're going to have to convince them that they have to feed this way. And so all these dogs came into foster care, and within a month, it's like, look at that, problem solved, huh?
There you go. Right, right. You was talking about your dogs. You told me something cool before we started that maybe I don't know if your first love was the Doberman dogs.
It was.
Yeah.
We got our first Doberman when I was in high school. Before that, when I was a kid, my mom always had a mixed breed dog, and my dad always had a hunting dog. So he was really into Llewellyn setters, which is a type of English setter.
Right.
So, so that's what we had growing up. And then in high school, my dad wanted a guard dog. So we got our first Marshmallow Doberman.
Oh, okay.
And I really love the Dobies. So my parents had a few. And then when I was a senior in vet school, about to graduate, I was like, I'm going to get my own Doberman. And silly me, I got a blue one. Now I know all the issues with those, you know, blue, tan, fawn, like those hybrid colors. You really don't want them. They have so many issues.
Yeah.
But he was the best dog in the world. And he died in a tragic accident at the age of 3.
Oh, sorry. Yeah.
So we had a couple more after that. And then when I met my husband, he had a giant Masso, which is Connie Corso Mastiff cross. And there were 2 bachelors that were totally untrained. so he had this 180-pound goofball, I mean, very sweet, but totally untrained. And he thought that my cats were chew toys. So that was a big issue. Yeah. And he didn't want to hurt them. He just wanted to play with them. The cats, no. And I had my Doberman, who was a big boy. He came from a breeder that bred for size. So he was 125 pounds. So here we are with 300 pounds of dogs.
Wow.
And they would play. We were in a fairly small house, and they would play so rough. And one day they were playing, and they got a little too aggressive with each other in the play. So I grabbed my Doberman by the collar and yanked him back and said, no, we're going to stop this. Because I couldn't grab the 180-pound. I couldn't move him. Right. So I grabbed my Doberman and said, no, we're done. And the next day he was paralyzed all 4 because he had wobblers. He had wobbler syndrome. And when I grabbed his collar, that did his neck in. So I've got a 125-pound dog that I got to lift and carry around and do everything with. The beauty of that story, though, is I ended up getting him in my car and getting him to my clinic. And he had acupuncture twice a day, cold laser therapy twice a day, and chiropractic treatments. And 5 days later, he was up running.
Whoa, really?
Yeah, really cool. Really cool.
Yeah.
But that having to carry the 125-pound dog around for a week, that was when I said, I'm too old for this. I cannot do big dogs anymore. And my daughter had a Cavalier King Charles Spaniel, and I said, man, I love this dog, and I'm switching. Yeah.
Yeah. Yeah, that is something to think about. You know, they somebody say, man, a person should think about when they want to adopt or even buy a dog from a breeder, they should think about the size of the dog. Can you pick the dog up?
Yeah. And what are you going to do when that old dog is weak in the hind end? I mean, we have help them up harnesses and all kinds of good equipment that we can use now to help us, but you still have to have some strength and ability. And for all you big dog people out there, make sure you get one of those harnesses for lifting. Do not use a towel. Do not try to do it yourself and get under their belly with your arms. Because if you hurt your back, you can't take care of your dog or yourself. It's, put the oxygen mask on first. Yeah. Do it correctly because, your dog is depending on you. And if you're flat on your back, you can't help your dog. Yeah. So love your dog enough to get them a good harness to help you. Right.
What are your thoughts on just dysplasia? We got a lot of tests for it now. We got the OFA, but do you think, or how much does environment play on the development of the or the impact of the joints?
So the biggest impact is spay neuter. When we spay and neuter these dogs before full maturity and before their growth plates of their bones close, those long bones, so the femur and the humerus and in the back and the front, continue to grow. And with that for too long. And so because they keep growing, it pushes the femur bone out of the hip socket. It pushes the radius and ulna out of the elbow socket. And so we end up with elbow dysplasia and hip dysplasia. There are great studies on this done in Rottweilers and golden retrievers and something else. We have huge evidence now. So I know it's a pain in the butt to have a female in heat, but you've got to wait until those long bones close. So with my clients, particularly with the big dogs, even with the little ones, but mostly with the big ones, I make them wait until 18 to 24 months for spay or neuter.
Right.
For the males, if you can keep them intact, keep them intact. Everybody says, oh, they'll be too aggressive. Actually, the studies show that the neutered dogs are more aggressive than the unneutered dogs.
Right.
And my little guy that hasn't had vaccines, he's also unneutered. The first one I'm doing it this way, because everybody else I've gotten through rescue, so they come already neutered, already vaccinated, chemical, blah, blah, blah. This little guy did come from a breeder, but he was the run of the litter, and he has hydrocephalus. And she said, well, I certainly can't sell him, and he's going to need a special needs home. So they rooked me into. I don't do puppies. I like seniors. And I got rooked into this little guy, and I mean, he's wonderful. He is definitely a special needs child. But, I thought, well, he's the run of the litter. He's got so many things going against him that, he was very slow to grow. He was only 10 pounds. A little rack of bones for the first 2.5 years. When he hit age 3, all of a sudden he filled out a little bit, but it took him that long. It took him until he's 3 to become what we call a real dog. He had to get to age 3 to actually eat food on his own without me putting the first few mouthfuls in his mouth for him.
Right.
Like, this is special needs. This is a problem. So I'm giving him every advantage I can by not putting a bunch of chemicals in him and not give him a bunch of vaccines, and I'm leaving him his little jewels because they're providing hormones that he needs for his bones and his brain. What little there is.
Right. Well, Dr. Morgan, I want to say I appreciate you. You covered all my topics. Right before we got on, I said, what you want to talk about? You told me, I said, oh, I got it all right here. So it worked out perfectly. But I do have one more thing I want to get from you. I want you to try to give the audience, if you have resources for people to educate themselves and seek natural alternatives. What are those resources for? Like your website, any books, things like that?
Okay. So my website's very simple, drjudymorgan.com, drjudymorgan.com. We also have Dr. Judy U. You can get to that by just going to Dr. Judy U or through the website. Dr. Judy U has over 40 courses that people can take. So if you're new to this kind of stuff, you might want to take dog longevity. It's a very short course, but it covers a lot of the things that we've talked about, gives you, narrows it down a little bit. But we have more advanced courses on allergies. We have courses from other experts. If you've never fed raw meaty bones to your dog and you want to learn how to do that safely, we have a course on that. We have a course on pancreatitis, which is a huge problem. We have courses on allergies, just all kinds of cancer courses, all kinds of stuff on there. And it's from a lot of experts, not just me. Like I said, I've written 9 books. The 9th one will probably be out in a couple of months. That one is going to be about dogs in group play, because dog parks get a very bad rap. Most veterinarians hate them. I have hated them for years, and I finally met somebody who's doing it the right way. And he said, can we write a book on how to do this the right way and keep our dogs safe and do it in a natural way? He's very into holistic. So we're trying to re-educate a whole group of people. My first book, From Needles to Natural, is kind of how I got from being that traditional vet selling kibble to where I am now. And then I've got 3 different cookbooks for dogs based on Chinese medicine, food therapy, actually 4. Then the Raising Naturally Healthy Pets, Keeping Your Pets Naturally Healthy, and our book on fleas, ticks, heartworms. It's a parasite book. That one is also available as a ebook download. So you can find tons, and if you don't want to spend a dime, that's fine. We have tons of free downloads. Our blogs are incredibly long and educational, and they tell you what supplements you can use for different diseases or problems. So if you can't remember my website, you can't remember anything else, and you're like, oh gosh, my dog has anal gland problems. Go to your search engine, type in dog anal glands, Dr. Judy Morgan.
Yeah.
Like, just put my name next to whatever problem your animal is having, and it'll probably bring up about 27 videos and 15 blogs and books. I've been producing this information since 2014. So it just accumulates. It never goes away.
Right. The co-producer Doug Coppage was telling me about you, and I went over there to your YouTube. I was like, oh my God, man, where I start? Because there's so much information.
There is a lot. It's been coming for a lot of years, and we are on just about every social media platform. So,
there you go.
Depending on your demographic, my age, we like Facebook. The next generation down, they like Instagram. The next generation after that likes TikTok. And then pretty much everybody likes YouTube. So, I mean, we're everywhere.
You also have a podcast as well.
I do. Naturally Healthy Pets podcast.
Yes, you do. Yeah. So, hey, she got it all, y'all. So, Dr. Judy Morgan, I really appreciate you once again. Thanks for spending time with us to educate us. And one day you might come back and see us if you get some time.
Thank you very much. It's been a pleasure. Really fun. Thank you.
Yes, ma'am. Likewise. Okay. Well, guys, we'll see y'all the next time. Bye-bye.
And that wraps up another episode of NWA Connie Corsos. Thank you for being a part of our Connie Corso community. Remember, you can stay connected with us beyond the podcast. Find us on all major media platforms by searching for NWA Connie Corsos. Whether it's Facebook, Instagram, Twitter, or YouTube, just hit that follow button to join the conversation and get the latest updates. If you have a burning question or want to apply to be a guest on our show, we'd love to hear from you. Simply shoot us an email at nwaconniecorsos@gmail.com. And if you're a business interested in becoming a sponsor, reach out to us at the same email address. For more resources, exclusive content, and links to all our social media profiles, visit our website at nwaconniecorsos.com. It's your go-to destination for everything dogs. Thank you once again for tuning in, and we can't wait to bring you more exciting episodes where we explore the fascinating world of dogs.